If your practice works with Medicare Advantage, you already know the days of ignoring RADV audits are over. Look at this chart. On May 21, 2025, the Centers for Medicare and Medicaid Services announced they are moving from auditing 60 contracts a year to reviewing every single eligible Medicare Advantage contract annually. That is all 550 plans every single year. And they are working backward. CMS is actively clearing out a 7-year backlog, demanding audits for payment years 2018 through 2024 by early 2026. The math explains why. MedPAC estimates that Medicare Advantage plans overbilled by $83 billion in 2024 alone. Of that, $17 billion is directly tied to unsupported diagnosis codes. CMS Administrator Dr. Mehmet Oz has made the agency's stance clear, stating they are committed to crushing fraud, waste, and abuse. They have expanded their coding review team from 40 reviewers to roughly 2,000 to make that happen. The statistical probability of your records being pulled is now a certainty. Defending against these audits is no longer a theoretical exercise. It is a permanent daily operational liability. When the audit notice arrives, the clock starts. Your team has exactly 5 months to pull the specified medical records and submit your defense. In the past, you might have pulled a few dozen charts. Now, the statistical sample size can reach up to 200 reviewed records per plan every year. Every submitted diagnosis code has to trace back to documentation that is specific and properly dated, verified by a clinician from a face-to-face encounter. Missing a provider signature or using vague language means a disallowed code. This logic model highlights a common trap. If you base a diagnosis code on a health risk assessment, but you lack the corresponding clinical visit note to back it up, that code is indefensible and will be disallowed. Even before this aggressive expansion, previous audits found error rates between 5 and 8% across audited contracts. If you are an at-risk provider in a shared savings agreement, those errors cascade directly to you. When CMS issues a recoupment to the Medicare Advantage plan, the plan will often seek to recoup that money from your practice under your participating provider agreement. An incomplete note from 2 years ago becomes a massive, undeniable demand for repayment today. The immediate reaction for most practices is to hand the audit notice to the existing billing team, but those teams are already managing prior authorizations, claim scrubbing, and daily payer follow-up. Building a dedicated internal team is expensive. This scale shows the baseline cost. Hiring a single AAPC or AHIMA credentialed specialist costs between $55,000 and $75,000 in base salary. That is before you even factor in benefits, taxes, and training. That assumes you can find someone to hire. As of 2025, there is a 12% nationwide talent gap for medical coders, and the staff you do have are leaving. Industry data shows a 40% turnover rate for front office support and billing staff. When the person who understands your specific payer documentation rules resigns, all of their institutional knowledge walks out the door with them. Relying on an in-house staffing model drains your cash flow and creates a highly fragile single point of failure in your revenue cycle. There is a more practical way to handle this. Smart practices are utilizing a dedicated, outsourced team strictly focused on RADV defense, a team assigned directly to your practice, not shared across dozens of clients. Look at the cost difference on this matrix. Instead of carrying a fixed $75,000 annual salary burden, Staffingly provides dedicated seats for $399 per week. You're getting the exact same caliber of talent. These are AAPC and AHIMA credentialed professionals with specialized expertise in HCC coding and ICD-10 specificity. This allows you to shift from retroactively chasing old records to running prospective chart reviews, catching documentation gaps before CMS ever selects your practice. The workflow uses predictive management to identify bottlenecks and AI-augmented internal audits to flag missing signatures well before the submission window closes. Like CMS itself, Staffingly uses AI as a speed and quality layer while ensuring that all final coding determinations are made by credentialed human experts. You trade the headache of managing in-house HR for scalable precision. You lower your overhead while significantly improving your accuracy. Pulling records across disconnected EMRs, paper charts, and various payer portals is usually a chaotic bottleneck during a standard audit. Staffingly bypasses that friction entirely. Their team works directly inside your existing EMR, whether that is Epic, Athena, eClinicalWorks, or others, accessing your system through an encrypted VPN. The security infrastructure is enterprise-grade. It meets SOC 2 Type 2 and ISO 27001 standards, is fully HIPAA and HITRS compliant, and a business associate agreement is signed before they touch a single patient record. Because they plug into your existing systems, your dedicated team can be fully operational in 14 days. If you are already holding an audit notice, that speed is critical. You also retain complete visibility. Every week, your CFO and COO receive a KPI dashboard tracking throughput, accuracy, turnaround times, and overall return on investment. By embedding a specialized third-party team straight into your EMR, you completely remove the audit bottleneck without creating a brand new IT implementation headache. The CMS audit wave is a permanent, unavoidable reality for any provider participating in federal health plans. The results speak for themselves. Across over 800 providers, Staffingly maintains an error rate below 1%, protecting millions of dollars from recoupment. If you're an overwhelmed practice owner, a Medicare Advantage organization, or an at-risk provider, this is how you build immediate, audit-ready infrastructure without the hiring burden. If your practice has zero exposure to Medicare Advantage or risk-sharing agreements, you do not need this service. But if you do, retroactively chasing records is a guaranteed loss. Building proactive, outsourced infrastructure now is the only financially sound defense. Go to staffingly.com/demo to start your 14-day deployment today.